Have you ever paused to truly consider the sheer, audacity and elegance of how a new life begins? It's not just biology.
Oh, absolutely. It's
Yeah.
like this meticulously choreographed dance, a hidden symphony playing out.
Exactly. And we often take it for granted, but the journey of pregnancy is anything but simple. So today, we're doing a deep dive into this astonishing world. We're going to sift through the science, uncover some surprising facts, some really profound insights that make this journey so incredible.
Yeah, think of it as your shortcut to really understanding the remarkable resources the female body dedicates to creating life.
Right. Our mission isn't just to list facts, is it?
Not at all. It's about pulling out those critical aha moments, giving you a deeper appreciation for this complex miracle.
And hopefully leave you feeling truly well informed about the whole journey, from that very first microscopic spark all the way to welcoming a new life.
Precisely, from
Yeah.
start to finish.
Okay, so if we're talking beginnings, we absolutely have to start with the female reproductive system itself. What are the foundational things we need to grasp, starting with maybe the ovaries?
Yeah, the ovaries are, well, they're central. They contain what people often call the biological clock. And here's where it gets truly mind-bending.
Okay.
A female actually has the most eggs, or oocytes, before she's even born.
Wait, before birth?
Yeah, we're talking a staggering number, like 7 million. But then by the time puberty hits, that number plummets drastically to maybe 400,000.
Hold on. So over 90% are gone before reproductive age even starts. That's incredible.
Yeah.
What does that scarcity mean for the eggs left?
Well, it really highlights just how precious each potential ovum is, doesn't it? And get this, only about 10% of those remaining 400,000 eggs will ever actually be released.
Only 10%?
Yeah, throughout a woman's entire reproductive life. It just underscores this incredible biological filter that's at play. And what's also fascinating is how the ovaries work together, like a team. Typically, they take turns releasing an egg each month.
Okay, alternating.
Right. But if one ovary is, say, absent or maybe becomes dysfunctional, the other one just steps up. It takes over the job, releasing an egg every single month.
That's amazing. Talk about resilience and backup systems built right in.
Exactly. It's a testament to the body's incredible adaptability.
So once an egg is released from the ovary, what's next? How does it start its journey? Where does it go?
Right. So it doesn't just float off. It's actually sucked in by these delicate, frilly, finger-like things called fimbriae. They're part of the fallopian tubes or uterine tubes, you might hear them called.
Ephemeria, okay.
And these tubes aren't just passive pipes. They're incredibly active. They're lined with tiny, tiny hair-like structures called cilia.
Cilia, like little hairs.
Exactly. And they beat rhythmically, creating this gentle current that pushes the oocyte along. Think of it like a microscopic conveyor belt.
A tiny conveyor belt. Love that.
Yeah. And this journey, it isn't instant. It can take a couple of days for the egg to travel down the tube towards the uterus.
A tiny, incredibly dedicated transport system.
Yeah.
Without it, nothing happens.
Pretty much.
And that journey leads right to the uterus itself, often called a living cradle. What makes it so vital?
Oh, the uterus has truly crucial roles. I mean, obviously, if fertilization happens, it harbors the embryo, provides nutrients, it's the safe space.
Right.
But it also has the muscle power to expel the fetus at term during birth. And beyond that, it produces various secretions and even helps sperm on their journey towards the egg. It's a really dynamic, adaptable organ.
Multi-talented.
Yeah.
And inside the uterus, there's another key player you mentioned, the endometrium. The ready bed. Tell us more about that.
Right, the endometrium. It's the crucial inner lining of the uterus. It's a mucous membrane, and it goes through this significant transformation every single month.
How so?
Well, throughout the menstrual cycle, driven by hormones, it thickens up, it gets plump, really rich with blood vessels. It's essentially preparing itself, like making a perfect bed, ready for a fertilized egg to come along and attach.
So it gets all ready, expects a guest.
Yeah.
But what if the guest doesn't arrive? If the egg isn't fertilized or doesn't implant?
Good question. If an egg doesn't attach, this meticulously prepared lining isn't needed, so it sheds. And that shedding process is what causes menstruation or, a period.
Ah, right.
And then the body just starts the whole process over again, preparing a fresh lining for the next cycle. It's this constant cycle of renewal, this readiness.
Incredible. And speaking of preparation, before an egg can even think about implanting, sperm has to get there.
Yeah.
Tell us about the vagina's role, especially its protective features.
Yeah, the vagina structure is fascinating. It's made of this special, stretchy skin, technically, stratified squamous epithelium.
Stretchy skin, got it.
This unique elasticity lets it expand quite a bit. in length and width during arousal and intercourse, obviously vital for reproduction. But it also has this built-in defense system.
A defense system. How does that work?
It maintains a naturally low pH. It's acidic, mainly due to lactic acid production by beneficial bacteria.
Acidic. Okay. Why?
Well, this acidity acts as a really effective barrier against harmful bacteria and yeast. It helps prevent infections like vaginosis, which can happen if the pH balance gets thrown off and goes too high.
So it protects the system.
Exactly. But here's the catch. That slightly acidic environment is actually quite challenging for sperm. They prefer things a bit more alkaline.
Oh. So how do they manage?
Sperm actually bring their own buffer. The seminal fluid they travel in helps neutralize the acidity temporarily, giving them a fighting chance on their, frankly, remarkable journey.
Clever counter strategy. Just shows how many chemical details are involved. Now, shifting gears a bit, but still about preparation. As pregnancy progresses, the mammary glands change drastically, right? Getting ready for nourishment after birth.
Absolutely. These glands undergo really significant development during pregnancy. Tiny structures called alveoli join together to form lobules.
Okay.
And these lobules then link up directly to the nipple, creating pathways for milk drainage.
And this is all driven by hormones again.
Totally. It's a whole hormonal symphony. Prolactin, estrogen, and progesterone are the main conductors here. They drive this development, making sure the breasts are fully prepped to produce and release milk when the baby arrives. It's amazing biological foresight, really.
It really is. All these parts working together. But they're not independent, are they? You mentioned hormones conducting the symphony. This brings us neatly to the menstrual cycle itself and the precise timing needed for conception. What are the key hormones we need to know?
Okay, so there are 5 main players in this hormonal dance. Gonadotropin-releasing hormone is GnRH that comes from the brain.
GnRH, okay.
Then follicle-stimulating hormone, FSH, and luteinizing hormone, LH, both from the pituitary gland. And finally, estrogen and progesterone, mainly from the ovaries.
Got it. GnRH, FSH, LH, estrogen, progesterone. So how do they orchestrate this cycle? What are the phases?
Right, so first up is the follicular phase. This is where FSH, follicle-stimulating hormone, does its main job. It stimulates the growth of about 5 to 20 follicles in the ovaries. Each follicle contains an immature egg.
No follicles grow.
Yeah, and as usually one dominant follicle starts to mature, it pumps out estrogen. And that estrogen is the signal for the endometrium, that uterine lining, to start thickening up again.
Connecting back.
Exactly. And an interesting point, the length of this follicular phase can vary quite a bit between women, or even cycle to cycle for the same woman. That's why overall cycle length can be unpredictable sometimes.
I see. So that phase varies.
Yeah.
What comes next? The critical moment.
Precisely. Next is the ovulatory phase. This is marked by a massive surge in luteinizing hormone, LH. This big surge, usually happening around day 14 in a typical cycle, is the trigger. It tells the dominant follicle to rupture and release its mature egg. Ovulation.
The moment.
The moment for potential conception, absolutely.
So understanding that LH surge is obviously key for people trying to conceive. I know you can buy ovulation predictor kits.
Right. Those kits measure LH in urine. When you get a positive, it means ovulation is likely imminent, usually within 24 to 6 hours. Super helpful.
Are there other signs women track?
Yeah, definitely. Many women track other telltale signs, like a slight, sustained rise in their basal body temperature. That's your temperature first thing in the morning. It usually bumps up just after ovulation.
Right.
And also changes in cervical mucus. Around ovulation, it often becomes clearer, stretchier, more like raw egg white. These are all, biological resources women can use to understand their own fertility window.
That knowledge is crucial. And it must really play into fertility treatments too, right? How do they leverage this?
Absolutely. Fertility treatments often involve medications to stimulate follicle production, basically, using hormones like FSH to encourage more than one follicle to develop. The goal is to increase the chances of getting a viable egg.
But that sounds like it could lead to multiples.
It can, and that's a serious consideration. You might remember the Octomom case. That was an extreme example resulting from, overstimulation leading to multiple pregnancies.
Right, I remember that.
Because multiple pregnancies, twins, triplets, or more carry significantly higher risks for both the mother and the babies, there are safety measures. Doctors use transvaginal ultrasounds, often around day 12 to 14, to count the number of developing follicles.
To see how many eggs might be released.
Exactly. And if there are too many developing follicles, they might actually advise the couple to avoid intercourse for that cycle to prevent a potentially dangerous high-order multiple pregnancy. It's a very careful balancing act.
Makes sense. Okay, so if the timing is right, sperm meets egg fertilization, conception usually in the fallopian tube, that creates the zygote, the very first cell. What happens right after that amazing union?
Well, from that single cell, things happen fast. The zygote starts dividing rapidly, becoming a little ball of cells. As it divides, it continues its journey down the fallopian tube towards the uterus. By the time it reaches the uterus, it's developed into what's called a blastocyst.
Blastocyst.
And then comes the next critical step: implantation. The blastocyst needs to attach itself to that prepared uterine wall, the endometrium. Ideally, this happens in the upper part of the uterus, usually within about 3 to 5 days after fertilization.
And that attachment, that's the official start of pregnancy.
That's the official start. Implantation marks the establishment of pregnancy.
And I've heard implantation can sometimes cause a little confusion.
It can. Some women experience what's called implantation spotting, or a light bleed right around the time the blastocyst attaches.
Okay.
It's usually very light, much lighter than a period, but it can sometimes be mistaken for one, which means, early pregnancy might go unrecognized for a little bit. And another crucial point about implantation, where it attaches matters. It really shouldn't happen too low down near the cervix.
Why is that dangerous?
Because if the placenta develops over the cervix, a condition called placenta previa, it can block the baby's exit path during labor, leading to serious bleeding and complications. It really highlights the precision needed at every single step.
Wow. Location, 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 even then. So once pregnancy is established, we enter the gestation period. What's the typical time frame? And what about viability? When can a baby potentially survive if born early?
Right. Gestation is the whole period from fertilization to birth. It's typically around 38 weeks from conception, plus or minus about 2 weeks. Since pregnancy is often dated from the last menstrual period, you'll usually hear it quoted as 40 weeks. Most births peak around 39 to 40 weeks.
Okay, 38, 40 weeks. And viability.
Viability refers to the point where a baby born prematurely has a reasonable chance of survival outside the womb, usually with significant medical help. This threshold has improved a lot over time. In places like New Zealand, for example, babies born from 23 weeks onwards might be actively revived.
23 weeks. That's incredibly early.
It is, and survival chances increase dramatically week by week. After 30 weeks, the survival rate is very high, around 99%.
That's a huge jump. You also mentioned sometimes labor needs to be induced if pregnancy goes too long.
Yes, exactly. If a pregnancy goes significantly past the due date, often beyond 41 or 42 weeks, induction might be recommended.
Why? Is it risky to wait longer?
It can be. The main concern is that the placenta, that vital lifeline, can start to age and break down after a certain point. Its efficiency in delivering nutrients and oxygen can decrease, which could potentially put the baby at risk. So induction becomes a safety measure.
Got it. And just to clarify terms, you hear embryo and fetus. What's the difference?
Good clarification. It's an embryo from fertilization up until the end of the 8th week of development. From the start of week 9 onwards until birth, it's referred to as a fetus.
Embryo, then fetus.
Yeah.
Okay, so this whole developmental journey is usually broken down into 3 trimesters. Let's walk through those. What happens in that critical first one?
The first trimester, the first 14 weeks or so. This period is arguably the most vital in terms of development. It's when all the major organ systems get laid down, the heart starts beating, the brain develops rapidly, lungs, eyes, arms, legs begin to form. It's foundational.
Everything's being built.
Everything's being built. And because of this rapid, complex development, this phase is highly sensitive. The embryo is very vulnerable to external factors, things like certain medications, infections, alcohol, radiation. These can interfere with development and potentially cause birth defects.
That makes sense. It's a delicate construction phase.
Exactly. This is also when the placenta and the umbilical cord form, establishing that crucial connection between mother and baby for the rest of the pregnancy.
Okay, so that first trimester is huge. What about the second? Months 4 to 6.
Moving into the second trimester, things continue to develop and mature. Organ systems keep refining. But for the parents, a big milestone is often feeling the baby move for the first time. Those little flutters, then kicks.
Ah, quickening.
Yeah. And the fetus starts to do more complex things. It can recognize voices, especially the mother's. Hair starts to grow, fingernails, toenails. It's becoming, more recognizably human-like.
More interactive, in a way.
Definitely.
And then the final stretch, the third trimester, months 7 to 9. What's the main focus then?
The third trimester is primarily about growth and maturation, or, as you sometimes hear, bulking up.
Getting bigger.
Yeah, the fetus gains most of its weight during these last few months. It's laying down fat stores, which are important for temperature regulation after birth. And it's practicing skills essential for survival outside the womb, things like swallowing amniotic fluid, opening and closing its eyes, developing grip strength, getting ready for the big debut.
Practicing life skills.
Mm-hmm.
Amazing. Now, throughout this whole 9 months, you mentioned the placenta is the lifeline. Let's talk a bit more about that incredible organ.
Yeah, the placenta is truly vital. It develops specifically for the pregnancy, usually attaching to the uterine wall. Its main job is to facilitate the transfer of nutrients and oxygen from the mother's blood to the baby's blood, and equally important, to transfer waste products, like carbon dioxide, from the baby back to the mother for elimination.
A two-way street.
Absolutely. It acts as the baby's lungs, kidneys, and digestive system, all in one, mediated through the mother. And that's why it's called the afterbirth, because it's delivered after the baby.
And it's important that it all comes out right.
Critically important. The entire placenta needs to be expelled after birth. If any fragments are left behind, it can lead to serious infection or hemorrhage for the mother.
Wow. And you also mentioned it's the pathway for substances, including medicines.
Yes, this is a really key point. The placenta is the bridge. Almost anything circulating in the mother's bloodstream can potentially cross the placenta and reach the baby. This includes nutrients, oxygen, antibodies, but also alcohol, nicotine, drugs, and many medications.
So that's why medication used during pregnancy needs such careful consideration.
Exactly. Every medication decision has to weigh the potential benefits for the mother against the potential risks to the developing fetus. It's a constant balance.
And surrounding the baby in the uterus is the amniotic fluid. What's its role?
The amniotic fluid is basically a watery cushion. It acts as a buffer, protecting the baby from bumps and jolts from the outside world. It also helps maintain a stable temperature, allows the baby room to move and develop its muscles and limbs, and plays a role in lung development as the baby breathes the fluid in and out.
A protective bubble.
Pretty much, yeah.
I know there's a procedure called amniocentesis that involves this fluid. Can you explain that briefly?
Sure. Amniocentesis is a diagnostic test usually performed between 15 and 20 weeks of pregnancy. A needle is inserted through the mother's abdomen into the amniotic sac to withdraw a small amount of the fluid.
And why do that?
The fluid contains fetal cells that can be tested for genetic abnormalities, like Down syndrome or other chromosomal conditions. It's typically offered to women considered at higher risk, perhaps due to age or family history, but it does carry a small risk of complications, including miscarriage, so it's not performed routinely on everyone.
Right, a specific tool for specific situations. Okay, one more hormone to touch on before birth. HCG, human chorionic gonadotropin. This is the pregnancy test hormone, right?
That's the one. Home pregnancy tests detect the presence of HCG in urine. Even a small amount usually indicates pregnancy has begun because it's produced by the cells that eventually form the placenta, starting right around implantation.
And doctors monitor its levels too.
Yes, especially in early pregnancy. HCG levels typically rise rapidly and predictably in a healthy pregnancy, roughly doubling every 48 to 72 hours in the first few weeks. Tracking these levels can give an indication of whether the pregnancy is progressing as expected.
What if the levels are off?
Well, very high levels might sometimes suggest multiples, like twins. On the other hand, levels that are too low or not rising appropriately could unfortunately indicate a potential problem, like an impending miscarriage or an ectopic pregnancy. Sometimes, if HCG levels are low but there's still hope, progesterone might be supplemented to help support the uterine lining and the pregnancy. It's like a chemical messenger giving us valuable intel.
A really important messenger. Okay, so all these complex systems, hormones, development, it all culminates in the incredible event of labor and birth. Let's start with natural or vaginal delivery.
Yeah.
How does the body actually do that? It seems so powerful.
It is powerful, and it's driven by this really unique physiological mechanism, a positive feedback loop. It's one of the few examples in the body.
Positive feedback. How does that work? Usually feedback is negative, right?
Yeah.
To maintain balance.
Exactly. Most systems use negative feedback to stay stable. But here, it's about building momentum. Think of it like a snowball rolling downhill, getting bigger and faster.
Okay.
As the baby's head presses down on the cervix, It stretches the cervix. This stretching sends nerve signals to the brain telling it to release oxytocin.
Oxytocin, the hormone we talked about.
Right. Oxytocin then travels through the bloodstream to the uterus and causes the uterine muscles to contract more strongly. These stronger contractions push the baby's head further down onto the cervix, stretching it more.
Which signals for more oxytocin.
Exactly, which causes stronger contractions and so on. It's this self-amplifying cycle that keeps building in intensity until the baby is born. It's quite relentless, actually.
Wow, a snowball effect. That's a great analogy.
Yeah.
And part of this process involves the cervix changing, right? Dilation.
Yes, absolutely. Two things happen to the cervix. Effacement, which means it thins out, and dilation, which means it opens up.
Yeah.
You often hear on TV shows, she's 10 centimeters, fully dilated.
Right.
That means the cervix has opened up to about 10 centimeters in diameter, which is generally considered wide enough for the baby to pass through. That marks the end of the first stage of labor, allowing the pushing stage, the second stage, to begin.
And there are stages to labor.
Yes, typically described in 3 stages. Stage 1 is the longest, from the start of regular contractions until the cervix is fully dilated. Stage 2 is the pushing stage, from full dilation until the birth of the baby. And stage 3 is the delivery of the placenta, the afterbirth.
Okay, 3 stages. What about when things don't go according to plan? Like the baby isn't positioned head first.
That's a significant potential complication. The ideal position is head down. If the baby is positioned feet or bottom first, that's called a breech presentation.
And that's risky.
It can be, yeah. Vaginal breech births can be more complicated and carry higher risks for the baby. Because of this, medical professionals might try to turn the baby externally before labor starts, a procedure called an ECV, or, more often these days, they might recommend a cesarean section, a C-section, to ensure a safer delivery for both mother and baby.
Safety first. And right after birth, the baby has a special name.
Yes, for the first month or so of life outside the womb, the baby is referred to as a neonate. And if a newborn needs intensive medical care, they'll go to the neonatal intensive care unit, the NICU.
Neonate, NICU, got it. So let's talk more about cesarean births or C-sections. You said it's a surgical delivery. When is it typically done?
A C-section involves making an incision through the mother's abdomen and then through the uterus to deliver the baby. They're often performed when a vaginal birth is considered too risky for the mother, or the baby reasons could include breech presentation, placenta previa, fetal distress during labor, failure to progress in labor, or previous C-sections. Sometimes they are also elected by the mother for various reasons.
And because it's surgery, recovery is different.
Oh, absolutely. It's crucial to remember a C-section is major abdominal surgery. The recovery time is significantly longer and often more challenging than after a vaginal birth. For instance, women are usually advised not to drive for several weeks, maybe up to 6 weeks.
6 weeks.
Yeah, and there are often restrictions on lifting anything heavier than the baby. This can have a huge impact on daily life, especially when you're trying to care for a newborn. It's a very different postpartum experience.
That's a really important consideration. Now, let's loop back to hormones one last time, specifically in labor and post-delivery. Oxytocin, again, it does more than just start contractions.
It sure does. We know it drives the contractions during labor. It's so effective that synthetic oxytocin, Pitocin, is often given via IV drip to induce or augment labor if needed.
Right.
But beyond labor, oxytocin is often called the love drug or bonding hormone. It plays a massive role in social bonding, not just mating behavior, but crucially in parent-infant bonding, facilitating those feelings of attachment and caregiving right after birth. And it's involved in milk ejection during breastfeeding, too.
Fascinating. Multi-purpose hormone. And what about the hormone responsible for actually making the milk?
That would be prolactin. Prolactin is the key hormone stimulating milk production within the mammary glands. It also contributes to the milk letdown reflex, the release of milk.
Okay, prolactin for production.
Right. And here's an interesting regulatory mechanism. Dopamine, a neurotransmitter in the brain, actually inhibits prolactin release.
Dopamine stops prolactin.
Yeah. So this means that medications that act like dopamine agonists, like bromocriptine, can be used to suppress lactation. This might be necessary if a mother chooses not to breastfeed or, sadly, following a stillbirth, to prevent the discomfort of milk coming in.
Wow, manipulating one system to control another. Okay, so beyond the obvious physical changes, pregnancy triggers this, like hidden revolution inside the mother's body, right? These deep physiological shifts that actually change how medications work.
That's a great way to put it, a hidden revolution. The changes are profound and systemic. For example, the cardiovascular system undergoes massive adaptations. Blood volume increases dramatically by like 40–50%.
Wow, more blood.
Yeah, a lot more. Cardiac output, the amount of blood the heart pumps per minute, goes up. Stroke volume, the amount pumped per beat, goes up. Even resting heart rate increases slightly.
So the heart is working harder.
Definitely. But interestingly, blood pressure often actually decreases slightly, especially in mid-pregnancy. This is because the blood vessels relax, reducing vascular resistance to accommodate all that extra volume. This drop can sometimes make women feel a bit lightheaded.
Okay. And you mentioned hemodilution. What's that again?
Right, hemodilution. It means that while the total blood volume increases a lot, the volume of the liquid part, the plasma, increases even more than the volume of red blood cells.
So the blood gets thinner.
Kind of, yeah. The proportion of red blood cells goes down slightly. It's like adding more water to the same amount of concentrate. This often leads to slightly lower hemoglobin and hematocrit readings during pregnancy, sometimes called physiological anemia. It's usually normal. And overall, total body water increases significantly, maybe 6 to 8 liters extra water on board.
An extra 6 to 8 liters. Okay, so with all these massive shifts, more blood, more water, changes in blood flow, it makes sense that drugs would behave differently.
Absolutely. How a drug is absorbed, how it's distributed throughout the body, how it's metabolized, and how it's eliminated, all of these can be significantly altered by these physiological changes of pregnancy.
And this isn't just theoretical, right? It has real consequences.
Huge real-world consequences. It demands a completely different approach to medication management during pregnancy. A dose that's perfect before pregnancy might be too low or potentially too high during pregnancy.
Can you give an example?
Sure. A key example is lamotrigine, an important anti-epilepsy drug. During pregnancy, the body clears lamotrigine much, much faster.
Clears it faster, so it doesn't last as long.
Exactly. Which means the concentration in the blood can drop dangerously low if the dose isn't adjusted upwards. This could lead to breakthrough seizures, which are risky for both mother and baby. So, women on lamotrigine often need significant dose increases during pregnancy with careful monitoring.
Wow, that's critical to know.
Another common example is insulin for women with type 1 diabetes. Insulin requirements often change dramatically throughout pregnancy, usually increasing significantly, especially in the later trimesters. Managing blood sugar effectively requires constant adjustment and monitoring. Healthcare providers absolutely need to be aware of these pharmacokinetic changes to manage medications safely and effectively, leveraging the body's resources appropriately.
It really underscores how pregnancy isn't just about growing a baby. It's a total transformation of the mother's physiology, too. We've covered so much today, yet it feels like we've only scratched the surface of this incredible journey.
It truly is astonishing. From that microscopic dance of hormones and cells, the intricate organ development, the profound changes in the mother's body, right through to the power of birth. It's just an amazing testament to complexity and resilience.
Absolutely. So, thinking about all this, the incredible precision, the timing, the self-regulation needed at every single stage.
Yeah.
What new appreciation do you, listening right now, have for this fundamental journey?
Yeah, and what questions does it raise for you? Maybe about how life even begins or the sheer potential held within the human body. Something to ponder, definitely.